Hi, this is Bianca Martinez, and I'm going to be doing my video assignment of the function of the lungs for our week 1 assignment for Adult Health 2. Using the model provided to us in the video, I was able to construct my own pair of lungs. So the 2-liter bottle serves as the body cavity, and the 2 small balloons will be our lungs. The lungs is how we are able to receive fresh oxygen into the body, and by exhaling, we are removing all the carbon dioxide and harmful waste from the body at the same time. So if you look closely, when you inhale or you have the patient inhale, you're breathing in that the 2 small balloons that are being portrayed as my lungs will fill up. Once you exhale, or you ask the patient, they can deep breath in and now out, the lungs will relax, not having any air fill with them. So inhale fills the balloons, exhaling will relax the lung muscles. And when we inhale using the large muscle surrounding the rib cage, which is known as the diaphragm, it will contract, and actually the rib muscles will move up as you're inhaling and will fill up your lungs with as much air as your cavity is able to take in. During the exhalation process, it's when the body is forcing the air out from the lungs. So inhale in, you're sucking in that air, and with exhaling, we are releasing it. In the exhalation process, the diaphragm and rib cage muscles are going to be relaxed as the air is leaving the lungs, just like how I demonstrated with the balloons. When it's inhalation, they fill up, and when you're exhaling, the balloons became constricted and it looked more relaxed because the balloons no longer had air in them. The air will begin at a high pressure point, moving to the low pressure area outside the lungs. And there's also the question of, for individuals that have larger lung capacities, for those individuals, it can be, for an example, those who happen to be taller in height, they are going to have a larger chest cavity, lung cavity, so they're able to inhale a little bit more air and exhale it. And also lifestyle can be a contribution to building your lung capacity. For example, if the patient or individual happens to be a smoker, it is likely they're going to have a small lung capacity, and that could be from the damage of all the chemicals in the tobacco, which, having the small lung capacity, they're going to have to be ventilating quite a bit more. So if you've noticed, maybe with a smoker, they're constantly having more respirations than what a normal lung capacity individual should be having. And there's also the next question is involving how asthma affects the lungs. Asthma can actually affect the inside of the walls of the airways in the lung, causing them to become swollen. So with individuals that are constantly having to breathe in and out, when they're having difficult, it's putting more pressure on the lungs airways, causing them to become inflamed, in which this can lead to the airway becoming more narrow, making it even harder for that individual to receive a good amount of air. And I don't know if you have noticed, when there's not that much lung capacity, or you're not able to breathe in that much air, it can cause the individual to start coughing a lot and wheezing. And number 5, what would be like the nurse's priority action when treating a patient with asthma? The priority action is going to be for the nurse to assess the patient respiratory status. This is going to mean listening to their breath sounds and assessing their oxygen saturation. This will give you an idea if the patient is getting enough oxygen into their body. Medications that are likely going to be given are a short-acting beta-2 to provide relief of the acute symptoms. This could be from them not being able to catch their breath. And I don't know if some have experienced when they have a constant cough or difficulty breathing, they feel pressure in their lungs or their chest. They can also be given corticosteroids, which happen to be the most effective in alleviating the symptoms. The nurse at the same time will be assessing the peak of flow of oxygen for the patient and monitoring the rest of their vital signs. Moving on to the next question, an intervention for an asthmatic patient is going to be they can have an ineffective airway clearance related to the tracheobronchial narrowing. Excessive secretion interventions will include to osculate for breath sounds every 1 to 4 hours. If crackles happen to be present, this can be a sign of an obstruction. It is important that the nurse monitors the blood gas volume and pulse oxygenation levels. Also, there is some quite a few community resources. There's quite a few I found for children. One being actually at the Phoenix Children's Hospital that I remember seeing as a kid, the Breathmobile, which is a self-contained asthma clinic, a mobile asthma clinic that provides screening, diagnosis, treatment, and asthma education, self-management for low-income and uninsured children. I was actually a patient of theirs when I was younger, but I outgrew my asthma. I think it was more related to like sports that I would get easily out of breath. And another resource for children is Asthma Athletics, which is a nonprofit organization serving children of low-income families in the community, giving them opportunities to be able to play sports without the judgment of having to take constant breaks because they are trying to catch their breath. I hope you enjoy my video. Thank you.